Hope all of you had a good exam. And I heard that when I talked with the candidates, and I felt the exam was of easy to moderate or moderate to difficult. Some was in between all these difficulty levels, but it is okay. And as I always tell, the importance of this recall section is not to check whether you have done the answers correct in the exam. It is to understand and improve for the further upcoming exam. So that is the concept of seeing these recall sessions. Usually in INI-CET type of exams, you will get around 5 to 8 questions from radiology. But this time it was in a lower rank, only 5 questions from where they're from radiology. In last NEET, if you see, there were around 10 to 15 questions in paper 1 and around 20 questions in paper 2. So every year, the number of questions varies. So it is very important to know which and every subjects. That is the concept. And this time, the radiology questions were a little bit haphazard and out of focus than the usual times. But it is okay. We will see how these questions. And remember, this is a recall session, which the questions I am showing you here is from different students who have attended. So there may be variations. So don't feel bad. So this was one of the questions that I got. There was a CT or MR angio image in which they labeled one artery and they asked to find out the vessel. So usually in exams, they used to ask about anterior cerebral or posterior cerebral or middle cerebral. That is the usual way till today. But yesterday, all these things changed and they showed a vessel here, which is in the outermost part. Somewhere telling which was not in the outer, it was this, but I'm not sure. Most of them were telling it was the outermost vessel. So in an MR or CT angio image, if they are showing an outermost vessel, then that is the terminal branch of external carotid artery, that is superficial temporal artery. Superficial temporal artery. If they are pointing the arrow towards the inner vessel, the vessel that is juxta, that is just inner to the outer one, then that is middle meningeal artery. So if the labeled vessel is the outermost one, then it is superficial temporal artery. Or if the marked vessel is the inner one, then it is middle meningeal artery. That is the concept. So in our class, we used to learn the anatomy. We used to learn this one is the anterior cerebral artery. This will be the internal carotid arteries. The ones which are going laterally will be the middle cerebral artery. This one is the posterior cerebral artery. All these concepts we learned from our workbooks and classes. Okay, so these were routinely done in our classes, but usually we will not give that much focus to the outermost vessels. But remember, this time they asked about that outermost vessel, which is the superficial temporal artery, which is a superficial temporal artery. So this was the question. So every year, the AIMS people will come up with something new. So this time they asked about superficial temporal artery. So remember, if they asked about the outermost vessel, then it is superficial temporal artery. And if the arrow was here, then it would be middle meningeal artery. This will be the ICA, this will be the basilar, and this will be like that, okay, the internal vessels. But this time they asked about the external carotid circulation. Okay. So in our question bank and workbook, we were giving importance to the CT and MR angiogram images, and usually we keep on sticking in and around anterior cerebral, middle cerebral, posterior cerebral, because which were very, very important till date. But now they have come up with superficial temporal artery. Usually INI-CET exam will be like this. So you have to read in and around the previous year topics. That is the concept. You cannot stop with previous year questions. You have to sit, you have to understand, analyze, and read more about these previous year topics. Topics are important. Another very important thing, usually radiology questions will be associated with images, but I heard this question was not associated with any image, but the history was a 60-year-old diabetic patient with breathing difficulties was there. And in the question, they told tree in bud appearance. CT showed tree in bud appearance. And some of the students are in question, there is low ADA level was given. Some were telling that it was high ADA level. I'm not sure. So if high ADA and tree in bud, then there is no doubt that will be TB. If the question showed history of fever, high ADA levels, then there is no doubt. Whenever there is tree in bud like appearance, that is definitely of tuberculosis. But if the question shows low ADA level and tree in bud, then you should think about other possibilities, because if the patient is having tuberculosis, then the ADL level should be usually high. That is actually a common sense. Okay, so in AIMS exam, when they are telling you that the ADL levels is low, you have to understand that that is a twist in the question. So if the question says low ADL level, then you should think about something like any fungal infections. Okay, fungal infections can show this type of train bud appearance. Any infection which can spread through endobronchial route will show train bud type of appearance. Okay, that is the concept. A train bud appearance comes because of endobronchial spread of infection. It comes because of endobronchial spread of infection. So if the question had high ADL level, then it should be necrotizing granuloma, and if it is low ADL level, then our answer should be fungal hyphae, because mostly it will be associated with some fungal infections. Okay, that should be the concept. So it will completely depend upon the question. Okay, so usually we will read about train bud appearance is usually seen in active TB because of endobronchial spread, but it can be seen in many other infections, bronchiolitis, and other associated conditions. That is the take-home point. And usually we, in our question bank as well as workbook, we will keep on emphasizing about TB. But remember, keep in mind, imaging helps you to make the diagnosis, but imaging can never completely make the diagnosis in most of the cases. Okay, so in these cases, when the clinical history is going to be very, very relevant, when the clinical history says low ADL level, you should think in terms of other types of infection. But if the question had a high ADL level, then definitely the answer should be TB. Okay, so it entirely depends on the question. Now, this is actually a very tricky question. Okay, no one can teach you these type of questions because you have to apply your knowledge, common sense, and all these things. Because this was a case of a 68-year-old old age patient unable to walk because of a trivial trauma. He had a fracture, and there is some pathology in the region of acetabulum. Most of the people were telling the acetabulum in the right side was seen, left side was not seen. So all of you were suspecting some kind of acetabular or hip pathology. So in these questions, you have to rule out each and every option. So first we can rule out eosinophilic granuloma, because eosinophilic granuloma is seen in children. Here in the question, the patient is 68-year-old. So you can rule out eosinophilic granuloma. So the differential, then we have to rule about Brown's tumor was the first option, disseminated tuberculosis, metastasis. Then for TB, they will usually give you the history of fever. So if there is history of fever, then you should think of TB. But most of you were telling that there was no history of fever. So I think we can rule out TB also. So TB is also ruled out. Then it will come between metastasis and Brown's tumor. So Brown's tumor is associated with hyperparathyroidism. So if there is any history like psychosis, renal calculi, abdominal pain, something like that, then you can do in terms of Brown tumor. Otherwise, most commonly when we read, we will know whenever the patient is more than 30 years of age, you have to think in terms of metastatic lesion. So if there is no associated histories given, because of the old age, you should think in terms of metastatic lesion. So I personally feel if there is no associated history is given, then the answer should be metastasis. But if there is history of fever or something cough or something like that, then you have to rule out tuberculosis. As well as when there is history of any kind of hyperparathyroidism feature, you have to rule out Brown's tumor. So here also the entire question can only give you the correct answer. Okay, that is the concept here. Otherwise, just remember, whenever you are dealing with an old age radiograph, metastasis should come to your mind at first. That is the concept. Okay, so and in our questions we have seen whenever you are dealing with tuberculosis, you will be seeing these Femistase triad. There will be hyperemia, there will be periarticular osteopenia like features. Okay, so if you want to make the diagnosis of tuberculosis with radiograph, any of these features should be given in the question. Okay, that is the concept. Otherwise, TB is very, very less likely. So this one is actually a very straightforward question. What is the investigation for ureteric stone or renal stone or whichever stone? You have to go for an NC-CT, non-contrast CT, because in our thumb rule sessions, you always say whenever you want to find out any calcification, any calculi, the investigation of choice is always NC-CT. So if you are strong with the basics, then this is just a piece of cake for you, because when you are giving contrast, it will obscure the calculi. So you should not give contrast. So CT will never be the answer. Then ureteroscopy USD, you know, calculi is better seen in CT. So the answer should be non-contrast CT. So we all know that. And okay. And coming to this, actually, every year there will be a question from barium. Usually, they will keep on sticking on with the atresia cardia as well as CA esophagus. But this day, again, they went for another case. But the history as well as image, I think it was very classical. There was history of dysphagia, bad breath, or some regurgitation like that. So you know when there is history of dysphagia, bad breath, regurgitation, you should stick on with the Zenger's diverticulum. Actually, Zenger's is one topic that we keep on repeating in every session. Okay, Zenger's versus Killian James and like that. We will always keep on repeating. So here in this image, you can see a diverticulum that is projecting posteriorly. So the answer for this is Zenger's diverticulum. So this is another important point. So what the take-home point is, I don't want you to just stick on with these options or answers or just see these type of recall videos and correct yourself. That is not the thing. You have to understand that whenever you are preparing for any kind of exam, you have to understand that you should be strong in the previous year topics, not in the previous year questions. All the previous year areas you should be thorough in and out. Okay, you have to dig it again and again. Then only you will be strong in those areas. That is the concept. This time, actually, it was very difficult. Only 2 or 3 questions were straightforward from radiology. Other questions had some twisting. The TB question, if there is high area, then definitely that will be TB. If it is low area, then fungal stands a good chance. So this is how exams will be. Always there will be twisting and turning. Okay. So all the best for you guys. Let's wait for the result. Meanwhile, start preparing for the NEET. Okay, NEET will be the goal for most of you guys. So don't be disheartened if you are getting 2 or 3 questions wrong. Just improve yourself. See this as an opportunity to improve yourself. Okay. So thank you guys. All the best.